Howdy! Thanks for learning about MS with me, Boster. In this video, we're tackling a really intense and actually frustrating topic: how insurance restrictions hurts people impacted by MS. The discussion is based on a recently published article which highlighted some of the barriers to care that insurance creates and how it results in more MS disease activity. Don't turn away, because all of that starts right now. Multiple sclerosis is an autoimmune condition which is incurable and chronic. It impacts 1 million Americans, and the data is very clear. Starting a disease-modifying therapy as early as possible is critical to stave off disability and to prevent MS attacks. Sounds straightforward, just get on a medicine. The reality, however, is not so straightforward. Let's jump in. The study we'll be exploring today is entitled "The Impact of Insurance Restrictions in Newly Diagnosed Individuals with Multiple Sclerosis." It was authored by a Dr. Ryan Mizell, MD, and published in the International Journal of MS Care in January of 2024. Now, I've included a link to the article in the description section below in case you'd like to read it yourself. The study reviewed 52 individuals who had recently been diagnosed with multiple sclerosis. It found that half of all the prior authorizations for treatment were initially denied. And when the denials occurred, the approval process stretched out 8 times longer than if the approval had been given upfront. Now let's think about that. What that means is there were weeks to months delays before someone just diagnosed with an incurable condition could start on their first therapy. Time is brain, and the earlier we can treat, the more brain we can save. Delays like that can lead to new MS disease activity, meaning new attacks and new brain damage on MRIs. Now here's the kicker. Patients who had an initial denial were 6 times more likely to experience new MS disease activity, meaning because of the denial, they had new MS attack or new brain damage seen on their MRI. 6 times more likely. This is not just a numbers game. We're talking about someone's brain. Insurance companies often cite cost-saving measures as the reason for these hurdles, which is massively ironic because delaying care often leads to more significant health problems down the road, which can be much more expensive to manage. Now, as many of you know, I want to place you on the most effective disease-modifying therapy as early as possible. And as it turns out, oral agents in MS tend to be more effective than injectables. And infused agents tend to be even more effective than orals. And in this study, we found something very disturbing. As compared to injectables, patients that were trying to get on oral agents were delayed 5 times more frequently, which is scary. Patients that were trying to get started on an infused medicine, the most effective medicines, were delayed 8 times more likely compared to injectables. That's very scary information. The study also looked at the type of insurance, and it turns out that really mattered. Patients that were relying on Medicaid to start their first disease-modifying therapy were 4.5 times more likely to be denied compared to patients that were using commercial insurance. This article clarifies that the system is broken and that something absolutely must change. The current American system of insurance, with prior authorizations as they stand right now, creates a barrier which results in people impacted by MS becoming harmed, suffering unnecessary attacks and brain damage as seen on their MRI. That's not okay. And there's something that we can do. If you or a loved one are impacted by MS, you can advocate and you can print this article off. You can send it to your MS neurologist and you can ask them to submit this article along with requests for approval. Make sure that the insurance company knows that you're aware that delays result in harming people impacted by MS. My name's Boster, and as always, thank you for learning about MS with me. If someone you love is impacted by MS, send them this video and help empower them to try to make change. Together, I really feel like we can make a difference.